Good evening, everyone. Hope you can see me live. I am Rita Sehra, Editor-in-Chief Responsible Hospitals, and I welcome all of you to our Insta Live session today once again. Today, a topic of talk will be all about cancer. So anything which you would want to know about cancer in women, the kind of cancers we deal in, the kind of cancers every woman faces, and what kind of challenges they face when they do not know about what cancer is. So I'm going to add my guest for the day. Just a second, I can just. Hi, Kunika, and hi, everyone. Welcome to our Insta Live session. So, our today's special guest is Dr. Naima Afreen. I'm just going to add her right here, and we'll start the session then. Dr. Naima, are you here?
Hi.
Yeah,
Good
I
evening.
can't see your picture, please. Can you hear me?
Yes, I can hear you.
But Dr. Naima, can you just check on your camera part? I can't see you. Yes, I can see you now. Hi. Can you hear me clearly now?
Yeah, good evening, everyone.
Yeah. So
So,
good
is it
evening,
visible now?
Dr. Naima. I'll just start with your introduction. So, guys, today we're going to talk about anything which is related to cancer in women. Majorly, we'll talk about the kind of different kind of cancers like cervical cancer, cancer in uterus. So, we'll talk about those questions. And Dr. Naima Afreen is with Sharda University as assistant professor, Obs and Gynae, and she's going to talk about all these in detail. So, anybody, any female who is listening to us can ask such questions. Team, is my face visible now? Because I can see the chat that my face is not visible. In my camera, it's quite visible. Can you see me clearly, Dr. Naima?
Yes, I can see you, but I think you should check the level of your camera. It should be a bit down because your forehead is not visible.
Is
I
it?
can see your beautiful eyes. Yeah. Yeah,
Thank
now
you.
it's again.
Is it okay now? Okay. So thank you. So Dr. Naima, I think we'll start the session. First of all, I would like to welcome you that that you have joined this session and you have given your time to attend it and to just talk about it more clearly, because this is something which is a panic situation for every woman or everyone in the family, I would say, when the cancer word arises. So we'll talk about it in detail, and I would like to start with that. Just tell us, what is cancer exactly, and what do you have to say when this word comes in everybody's mind?
So, first of all, thanks, Richa, for inviting me here. And I must congratulate all of you for taking this good initiative, and it just spreads awareness. So, hats off to you for this. So, as today we are here to discuss about cancer. And cancer, this word looks very scary.
Yeah.
So, actually, we know all of us who are here, we know one member, either in family or among our friends or some relatives, who are having cancer or who are just so sick because of cancer or who may have died unfortunately because of cancer. So, this is how
True.
rampant now it's going to be. But people ask questions sometimes. What is cancer? How does it come? So, what is the basic behind cancer? Cancer is nothing but it is arising from your own body normal tissue. But the thing is that our body tissue, God has made some mechanism because of which our body divides, and it knows where and when to stop. Because if something keeps on dividing and dividing and it's not stopping, then what a mess is going to happen. So similarly, in our body, we have mechanisms, we have cells and genes who know when to stop the body, when to stop the cells to stop growing. But in cancer, these cells become abnormal and they just keep on dividing and dividing and they form a big tissue. So this could be a lump, this could arise in the form of swelling, and sometimes it just adhere from this from the part of origin, and it goes to some other parts of the body as well. So this is nothing else but cancer. It is an abnormal cell division.
Okay. And any specific age would you like to talk about? This is the age which focuses more about cancer, and any, because we do not find in more younger people, but nowadays, yeah. So nowadays, we have been seeing people who are quite young in the age, and still they are getting so frequent cancers. Within every 5 people, you get one who is having cancer, and it's getting more frequent.
More
When you compare
common.
with the older times,
We can
what could be
say
the
that,
reason
Richa,
about
ki
it?
it is becoming more common. And this is one aspect that we are seeing, it is becoming more common, and we are blaming each everything on environment, on our lifestyle as well. So yes, it has something to do with our lifestyle. Okay, but second aspect is that which we don't think is that nowadays, because of the progress of science and technology, we have got some very good sophisticated instruments, tests, because of which we are catching it early. So that's why now we are finding in young people as well, we are finding it. So we are saying that it is now increasing. So it's because we have got very good technology which is detecting it at an early stage. So it is causing an increase in the apparent increase in the incidence of cancer.
Okay. And what do you think? Since you said it very correctly that we always blame that, we always talk about that this has happened because of the lifestyle, maybe the pollution, a lot of people are there. So what do you think? What is the main cause of it? Which people can actually take a benefit out and they can work on it. Maybe they can be safe.
Environment has a definite role to play in it, and the main thing is that something which is happening at the gene level as well. So there are some mechanisms which are in our hands and some mechanisms which are not in our hands. But talking about females, it's a very general thing which I'm talking, that females, they just take their health at granted. So like we are first concerned, very much concerned about our family, about our career, about our kids. Okay, if we are not married, then we are thinking about ourselves, but we are thinking about what dress to buy, what makeup items to purchase, but we are least bothered about our health. We are
Right.
neglecting our. And even if we are living in a family, many a times, even I have seen in my family that my mother used to feed feed her kids first. Then she always thinks about her husband, whether he had his meals or not, and at the end she thinks about herself. So we have to change our
Right.
attitude. So the change in attitude is so necessary that we should eat together. This is a very basic thing, because like we have started eating, so whatever it's on the dining table, we have salads, we have some accessories as well. So we should eat each and everything. Our plate should be of 7 colors. This is a thing which my teacher always used to tell, that your food plate should have 7 colors, jo satrangi kehte hain. So it should be like something which is of red in color, something which is green in color, some white, some so like it should contains each and everything. So when your plate is in of 7 color, then it will contain all the basic nutrients which are necessary for your health. So specifically talking about cancer, nowadays we are seeing an increase in most common cancer. I'm telling you, in the word is lung cancer. Okay, but in females specifically, we are talking about the female genital tract cancer. So you should know about overview about the anatomy. What organs do we have where we can see cancer? So first of all, we have like vulva, vagina, we have cervix, uterus, and ovaries. So
Right.
what are the causes of cancers in these organs? So firstly, I would tell that genes has a lot of role to play. One thing, environment factors, some occupational hazards, some chemicals, even X-ray exposure and CT scan. People are so much fond of getting. Some people are having headache and they just want their CT scan to be done. Just for a simple headache, they pressurize the doctor that no doctor, just I want a CT scan to be done. I want to rule out everything. And it would be surprised to know that one CT scan is equivalent to around 200 X-rays. 200 X-rays. Can you imagine? So
Oh my
there is
God.
some certain limits which is allowed. Yes, you can undergo some X-rays, but there is certain limit. After that, you should not go. Then again, it is going to cause some mutations at your cell and at your genes level. So, so you should be very careful about that, and you should always consult your doctor before taking any treatment. And specifically talking about cancers, it is seen that in females, those who are not taking good care of their perineal hygiene as well, who are low socioeconomic status females. So everything comes to education at the end. Lack of awareness, lack of education, lack of awareness about vaccines. All these contributes to cancer in one or the other way. Secondly, like lifestyle, as you said, what changes are we seeing in our lifestyle is not because it's because of our changing dietary patterns that obesity, diabetes, hypertension, they are becoming very common. And obesity is nowadays coming as a epidemic only. Even in US, you can say nowadays we are modernizing. So whatever trend was there in America, now it's coming to India. We have changed our lifestyle, we have changed our eating pattern as well. So obesity, which was more common in America, now it's becoming common in India as well. A lot of diseases. It affects our body badly. So we should consider that thing also. Apart from that, yes, age is a big factor. So with aging, our cells also become less viable. So it is your family history. Get to ask about that from your mother and your father side, that if on your maternal side or on your paternal side there is history of any kind of cancer in the family. Okay, in first degree, that is the blood relatives, as well as in second degree relatives. Cancer family. And there are certain chemicals which are carcinogens, radioactive materials. So you should be aware of that. And that way it will help in protecting.
Sure. Uh, your network is going. Can you hear me?
Yeah, I can.
Okay. So, doctor, thank you so much because it is seriously important to know. I'm understanding for the first time more deeply. Yes, we are aware of, what vaccinations which are available, but I'm sure there are a lot of women who would like to know that, and we will talk about it. Uh, Before that, I would like to ask you, since you mentioned about the lifestyle part, and what do you think about the food which is available? You just mentioned about that, आपका जो food है, that should be like rainbow meal, I would say. So what do you think? Because आजकल इतने food में there are so many pesticides which are coming in. You yourself is so confused what to eat, what not to eat. Whether you are eating a protein diet or you must be thinking that you are eating a good food, when on the other side you are eating actually a lot of pesticides. So you land up eating the dals and chanas and all. So I don't know. This is a question from a lot of people. What do you have to talk about the food which is available in the market these days, the vegetables, the fruits? People are so confused. You buy a banana today, and then you land up that there was a time जब घर में एक banana आता था, and वो 5-6 दिन भी मतलब you refrigerated and it was fine. Nowadays on the next day they look so nice and beautiful from outside. On the next day, it has nothing. It's just gone. So, will that also play a role having this problem?
Actually, Richa, yes, food has a role to play, but हम इतना नहीं सोच सकते. Like we can advocate people to take healthy diet, so that will constitute fruits as well as vegetables. So what we are advocating is not to take junk foods. So this has to be initiated at a very early age, because you know kids are becoming so much fond of, why at McD only two three things are available, you know, French fries, burger, and along with cola. So these are the fizzy drinks which are available at these. And why they are selling that, you know, because it is common, people are fond of taking these things. And even, you know, my kids, they are so small, still they just want these kind of things during lockdown. And you know, we have to prepare it for them. So what do you want for your breakfast? They will say, I want French fries, mama. So it now the eating trend is changing so much. You know, my child, if he or she wants noodles, so now what I have to we have to modulate accordingly. Okay, if I am making or preparing noodles for them, so then I'm adding egg in it. Okay, or if I'm making some kind of pizza for them, so I'm not using a lot of cheese in it, I'm using paneer instead. Okay, so then you have to modulate according to your child wishes, because you cannot say no to them. You just say no, and you just see that what a mess they are going to create for you. They will keep on crying, mama, no, I want this only. So food is something which is a basic necessity, and we cannot refuse. So a mother has to know how to just make them happy with the kind of food which is available at your home only. So you know, you were talking about fruits. So yes, there is some kind of changes which are happening, but we can't say no to these kind of fruits, because apples, you can see it's fresh apples which are available in the market, and there's nothing wrong in taking this. But the thing is, basic knowledge which has to go in the people, in the common people, is that avoid cheesy material, about avoid lot of oily things. You have to avoid sugar, because it contains, because it's nothing but carbohydrates. So lot of fizzy drinks, you know, the colas and Pepsi, what they are having, they are just aerated drinks which are having lot and lot of sugar. That's it. Okay, and these are the things which are contributing to obesity, be it a zero calorie or whatever it is, but it is not good for your health. So from a very young age, this should be instilled in the mind of the kids only, that what things are not good for you, not good for your health, and you should always eat together. This I have found, that if your child is eating alone, or you have given something for your child to eat in front of a mobile, he's watching a video and he's eating, he'll be very slow at eating, he will not look into the food, will not having any interest in that food. So you have to create interest, always sit together on the dining table with the, even small kids, you should be there. Then you always tell them what things are there on the dining table which are good for your health. So I'm telling you that you should always prepare some green leafy vegetables. And if they're not getting used to of eating things, then you should add something which will, some creativity should be there which will make them happy. Okay, so there's something which is different and I'm going to eat this. Okay, some kind of molds you can take and some designs you can make on the plate, and उनको interest आता है. Okay, it's like a cartoon over it, so I'm going to eat it. So these are the green eyes. Okay, I'm going to eat these monster eyes. Okay, so then they will eat it. So
That's
your
so
plate, as I
interesting.
say, all the seven colors, you should always consume one or two fruits a day. It can be one apple, it can be one banana, but nothing in excess is good for your health. So even dry fruits, you should always carry some dry fruits. If you're going to office or to your school, you can give some dry fruits to your kids as well, but it should not be more than a fistful daily. Okay, anything which is in excess is just harmful.
Sure,
Apart from
sure.
diet, some knowledge should be given, not to the kids but to the adolescents, about the side effects of smoking and drug abuse, because you know this is the age when they come to know about all these things, alcoholism and drug abuse. So this is the age when you should keep telling about the things and keep talking about your children, to the adolescents, that what are the problems which can arise because of this. So it should be
Sure.
a
Thank you
balance.
so much. It is so
That's the main
enlightening.
idea.
I think these are the great ideas you have given for mothers. I'm sure that will really help them to get some creative ideas to make and prepare meals now. So thank you, and we'll move to the next topic. And do tell us, what is cervical cancer? We'll just take one by one the cancer parts. So just tell us, what is cervical cancer, and if we can know more about it, and then we will talk about the screening of these uh, screening of those and vaccination available for cervical cancers?
So, for everybody, I would like to tell what is cervix. So, in human females, we have a uterus, and then the mouth of the uterus is called cervix. So, this is the thing which is available when a doctor does an examination. Uterus is something which is inside the body, okay, and cervix is something which is hanging inside the vagina. It is called also called as mouth of the uterus, you can say in a simpler term. So this is something which by some instrument we can see, we can visualize this cervix. And cervical cancer is very, very common in India. It is so common that one female is dying every 8 minutes because of cervical cancer in India. I'm talking about India. And the word problem is like every 2 minutes, every 2 minutes, one woman die because of cervical cancer. So first, most common cancer in the world is breast cancer. Secondly, it's cervical cancer. And in rural India, cervical cancer is still first most common cancer. And the best thing is that it is a cancer which is preventable. In females, there are only two cancers which are preventable, and it is very much in our hands to detect it very early. So that's why screening is always advocated for, specifically for two cancers. One is breast cancer and second one is cervical cancer. So why screening is important? Because it progresses slowly. It gives us a lot of time. Like if some pre-invasive, that is cancer होने से पहले कुछ lesions होते हैं, there are some pre-cancerous lesions which appear in the cervix. So if we are detecting it at that level, so we still have 10 to 15 years time for that cancer to progress to become a full-blown cancer at the stage from which we can give only palliative care to them. At some time, no surgery is possible in cancer, and we can just help the patient by pain relief and all. So at least God has given us so much time that we get in hand 10 to 15 years in time. That means this cancer is spreading slowly. But the thing is, you have to screen the masses. Okay. And, a basic idea about screening is that screening is done only for those diseases which are very common. And we screen all the normal population to pick the patients, to pick the people who are having the disease or who may develop the disease. So that's why mass examination is important. And the good thing is that it is also very cheap and it doesn't take much time. So, I would like here to tell something about the risk factors of cancer, because I guess that on Insta, a lot of young people are also there. So, I would like to tell that this cervical cancer, the risk factor is coitus or the intercourse if it is happening early. Like if it is happening before 18 years of age, earlier than 18 years. Okay, then it is a risk factor. People have become more prone. They are at more risk of having cervical cancer. Secondly, excuse me. Secondly, if there is first delivery at the age of less than 20 years, before 20 years of age, then it also increases the risk. Multiple sexual partners or a promiscuous behavior is increasing the incidence of cervical cancer. Or if there are multiple pregnancy, very poor birth spacing between the child, then it increases the cancer among them. Also poor personal hygiene, specifically you can say that low socioeconomic status is only because of ignorance, lack of awareness, that predispose them to cervical cancer. Smoking, drug abuse. Apart from that, most important thing, because now we will definitely talk about the vaccine as well, something called as HPV, that is human papilloma virus. There are hundreds of strains of this virus, but there are few strains which causes cancer in almost all the cases. I think 90% of the cervical cancer are happening because of human papilloma virus. Specifically, there are some strains, it's not very important for everybody, but there are some strains 16, 18, which causes cervical cancer. Excuse me. So you should know about the sexually transmitted diseases as well. So among that, mm, uh, And the human papilloma virus, the which is causing this infection, best thing is that if a young female is going to have this infection, our body will clear this infection on itself. That's why screening is not recommended for human papilloma virus before 30 years of age. But after 30 years of age, we say that you should go for a testing for human papilloma virus. And specifically, one more risk factor is if the patient is immunosuppressants, like he or she is on some drugs which is decreasing the immunity, like steroids or some anti-cancer drug, or the person is having HIV or AIDS, then in them the risk of having cervical cancer increases.
Sure. So since you just mentioned about the screening part of it after 30 years, I mean, is it, does it happens to be once in a year? Is that what you are recommending? How does it work?
Yeah, it is a very good question, because these kind of doubts arise in our youngsters once they become sexually active, and because of the fear of talking these kind of things to their parents, they are not very much comfortable. उनको लगता है
Yeah.
कि इस तरह की बातें करेंगे तो मम्मी पापा तो फौरन डांट लगा देंगे. Secondly, even what I found is that some doctors even the youngsters are not very much compatible to talk about all these things. So what we really need is stigma free consultation. So a lot of people
Absolutely.
are doing it, and I am also an advocate of such kind of thing. So if you are into like you want to know about the sexual health, you have this right to know about each and everything. If you're not getting this knowledge, then only आपको इसी की वजह से प्रॉब्लम होती है. Not having a proper education leads to the problems. So the thing is that there should be stigma free consultation for all the adolescents. Okay, so we were talking about screening. So screening for HPV should not be done before 30 years of age, because most of us will have this virus in our or body, but our body kills or clears human papilloma virus completely by itself. So screening is necessary after 21 years of age, first thing, and it is done after every 3 years. It is not done annually, not done after every 2 yearly. It should be very clear in mind that it should be done only and only after 3 years. Okay.
Okay.
Secondly, if the female is 30 years or more and she wants to go for cervical cancer screening, so you can offer the patient, or you can offer the person with human papilloma virus testing along with a pap smear. So the screening is done by pap smear and by human papilloma virus testing as well. So once we combine these two tests, we call it a co-testing. So if we are doing this co-testing, then we have to go to our doctor only after 5 years. So this is a big gap.
Wow.
So this screening comes after every 5 years if you are doing a co-testing, and that too you can continue till around 65 years of age, and you can stop testing after 65 years if the previous 3 reports are normal. You don't need to go
Sure.
for the test again if it's normal.
Okay. Sure. And which are the so we have any vaccination which is available, and do you think that really cures women to get this virus, to get this cancer basically?
So yes, fortunately in India nowadays vaccines are available. But before vaccine, just a word about screening. People are very afraid of screening. They think that this test is going to cause a lot of pain. So please, it's a very simple test. It's an OPD based test. OPD means you just have to come visit a doctor and like simple examination only. There is a spatula, which is a wooden spatula, and a brush. So we just take samples from the mouth of the cervix by that brush and by that stick, and we make slides of it and it is sent. That's it. It's as simple as that. So it doesn't cause any pain. And sometimes even if it's free, most of the females don't come. Like some hospitals have the policy that we are going to check, we are going. So they are sometimes afraid and they are not going for a pap smear because of the fear of having pain. But actually it's painless. It's very much comfortable. So we are fortunate that in India we are having vaccine for cervical cancer. And the countries who have adopted these cervical cancer vaccines, we have seen a drastic decrease in the incidence of cancer. In countries like Africa, there are organizations who are supplying cancer vaccines. okay, which is free of cost in these countries. So the studies have found that there is decrease in the number of cancers which is appearing. So in India, it's just an optional vaccine. It's not in the national immunization schedule, that is the compulsory vaccines. It's not there, it's just optional because it's a bit costly, not very costly, but yes, it costs a bit more. So like other vaccines, they are very much free of cost at government, so it's costing something, so some people are not going for it. But there are two types of vaccines which are available. One is for 2 strains and one is for 4 strains. So it comes with the name of Gardasil and Cervarix. And best thing is it is protective against the cancer cervix, especially by the cancer which is caused by these 4 strains or these 2 strains, which are the most common ones causing cervical cancer. And the dosage is very simple. It is at 0, 1 and 2, or okay, or 0, 2 and 6. But if you are taking it at a very early age, it is advocated that it should be taken early, before the start of sexual intercourse. It should be taken. The earlier you are taking it, the better protection you will have. So, at what age we ask the patient to take, we ask the girls to take it. It is to be taken between 9 to 12 years of age, as early as that. So, this will come by, there's still a generation gap, and it will come gradually by this awareness only. And Richa, you are doing a very good job, because this is also again spreading awareness only. People
Yes.
will start taking this vaccine at an early age, then only the purpose of protection will be served. But somebody comes to you, like she came to know about the cancer vaccine at say 20 years of age, still you can offer her, she can take this vaccine, because something is better than nothing. But we don't advise for this vaccine after 40 years of age, because it will give very little or negligible protection to you, because this HPV testing we are doing after 30 years of age. Before 30, there is no need to test for this virus even, because our body is clearing all the infection on itself without the need of any medicine or any test or anything. So we don't need to go for it. So yes, before intercourse, ideally between 9 to 13 years of age, this vaccine should be taken.
That's
And
super. That's super.
one more thing, that vaccines it's providing protection to boys as well. Although it is not very common in India, boys are not taking it, but it is protecting against some warts and even against the penile cancer as well.
Okay.
The cancer is, it also provides some protection to boys also.
Interesting. Cool. I'm also going to pick up some questions which I'm getting online. So just got a
Sure.
question. Does the vaccine for cervical cancer work if you get it after being sexually active?
So I couldn't
Could
hear
you
you
hear that?
even ask.
Yeah. So the question is, does the vaccine for cervical cancer work if you get it after being sexually active?
So that's what I told you. The earlier it is taken, it is better.
Yeah.
But if you are taking it, say, at a later date, say 20 years, even then, it is effective, although the protection level is a little bit decreased. But yes, even then, it is going to provide you some kind of protection. But boys and girls should not think that we have taken this vaccine, so we don't need any kind of testing now. बस अब हमने तो ले लिया है ये वैक्सीन, अब हमें कैंसर तो हो ही नहीं सकता, and they become very callous and very casual in their sexual attitudes. So no, it should not be like this. Even then, you should go for your pap smear test, your HPV testing. You should keep on doing that tests, and you can take it even at
So there is
20, 28 years. But
So
yeah,
there is no harm on getting these tests, frequently. There is
no.
no side effect as such.
Yes, they are actually very much beneficial, because once in a while you are going to visit a doctor. Like after every 5 years, it will not bother you if because we people are now getting our health checkup annually. So gynecologists are calling you after every 5 years.
True, that's right. So let's move to the other topic, which is ovarian cancer. If you can just talk about it, what it is, and again talking about the vaccinations and screenings.
Richa, actually, there is no vaccine for ovarian cancer. But this cancer is something which is a very silent type of cancer. That's why there is not much talked about the screening of this kind of cancer, because it happens usually in old age, first thing. And secondly, it does not have any specific symptoms by which you can detect that yes, this person is having ovarian cancer. We talked about cervical cancer. In this, patient usually have some kind of post-coital bleeding, like after intercourse patient is having some bleeding, so he or she becomes alert that why I'm having this bleeding, I should visit a doctor. Okay, even if we just talk about fever. So fever is not a disease, it's just a symptom. आपके body में कोई infection आया, you have fever. So now you become alert. Okay, I'm having fever, so there's something wrong with my body here. Either I have some respiratory tract infection or some urinary tract infection. So you will visit a doctor. But what happens in case of ovarian cancer? The symptoms are very vague. Vague in the sense, just bloatedness, indigestion, early satiety. That means भूख नहीं लग रही है और खाना खाने का दिल नहीं करता है, indigestion है. Okay, that's it. They're not having some specific. Very few people can have some menstrual abnormalities as well. Especially the females who had attained their menopause, they can have post-menopausal bleeding. That is, they after their menopause they have some bleeding or spotting. So in them we go for the testing. But what? So suppose if a patient is having, a person is having just early satiety, जल्दी से भूख मर जाती है, भूख नहीं लगती है, खाना खाने का दिल नहीं कर रहा है, acidity, some bloatedness, so they don't go to the doctor. And when the patient comes to us, sometimes the disease has spread so much that it's very difficult to save the patient. So also it is like seen as an incidental finding, that patient has come for some other purpose, visited to us, and we found out that there is some mass inside the ovaries. So that's how it is detected. So especially if a post-menopausal or a perimenopausal, means the person who is just about to attain her menopause is having some vague symptoms. So you should visit to a doctor once, get yourself screened that everything is normal or not, because this cancer is a very silent kind of cancer. It doesn't have any specific symptoms by which you can pinpoint, no, this patient is having ovarian cancer only. And it is, this ovarian cancer is second most common cancer among the genital tract cancers also. So it usually happens between the age group of say 45 to 65 years of age group. And there are some again risk factor for it. So first and foremost is the family history. You should be aware that if some kind of cancer has happened in your family, either on the mother side or on the father side, it can be cervical cancer, it can be breast cancer, or any colon cancer. They have some connections. There is a gene called as breast cancer gene. Okay, so there are two genes, BRCA1 and BRCA2. So if a female is having a breast cancer gene, either in her or in her first degree relative or in her second degree relative, so there's chance of this female of having breast cancer gene. So this can cause ovarian cancer as well as breast cancer, and some colon cancer is also present in them. So like all of you must be knowing about Angelina Jolie as well. So this gene was detected in her. That's why she got a mastectomy done for the prevention of breast cancer. So that's why screening of your first degree relative and your second degree relative is very important. Secondly, if somebody is taking hormone replacement therapy, which is unsupervised, she's not meeting a doctor every time, she's just taking it. Hormone replacement therapy people are taking for good quality of life as well. So it should never be unsupervised. You should always visit a doctor, because there is one component which is estrogen. So unopposed use of estrogen predispose the patient to ovarian cancer, especially in the females who are having PCOD. They have high content of estrogen. So
Okay.
again, they are at high risk of having ovarian cancer.
So, doctor, since you just mentioned it very nicely, so I just wanted to know that what are the warning signs of these ovarian cancers? Because indigestion, and sometimes you usually feel that, I'm not that hungry, I don't want to have food. You do not realize that there could be something big which is happening in your body. So, what is a warning sign when you recommend, if these are the things which are happening with your body? you must go to the doctor and get this screening done?
So firstly, which I talked about, that if a patient is of perimenopausal or a menopausal age group and she's presenting with vague symptoms, always get her screened. And screening of this cancer, it is not very easy, or you can say कि mass level पे हम ये screening नहीं कर सकते हैं. Pap smear, it just hardly cost you around 100 rupees. But this
Okay.
cancer, for screening, you require an ultrasound, you require a test called as CA125 testing, which is a tumor marker which you get test. So it is not applicable to each and every. We are not going to test it on masses. We usually screen the females who have a strong family history of cancer, or who had a previous history of breast cancer in them. We select, these are the high risk patients in which there is chance of having ovarian cancer. Secondly, one more thing is that ovaries in postmenopausal female, they are almond shaped in a normal female, and they regress in size once you attain menopause. So if in any postmenopausal patient, a gynecologist is able to palpate this ovaries, so it is then three times, it is palpable only when it is three times enlarged of its normal size. So in that, you have to go for the testing. So the testing is done by an ultrasound. As I told, that sometimes it becomes just a coincidental finding that patient has gone for an ultrasound for some other, say gallstones or some other purpose, and just it was came out with a big shock that she's having some mass in the ovaries. So screening is actually targeted only. It's not like we are not offering this to each and every female, but yes, so that's why we recommend, if you are going for a health checkup annually, so at least you are getting an ultrasound done. So by that way, there is high chance that you can detect it.
Sure, sure. And we'll just move to the other part of the cancer, which is uterus cancer. So, what is that? If you can just talk about it, please.
Uterus is the part of the body which has something to do with childbearing. And we always say that God has made each and every part of the body for some specific purpose. So that's why it is seen like breast. So it's for breastfeeding. So, the patients who do not breastfeed their child, or who are not into breastfeeding, they have higher chances of having breast cancer. Similarly, the persons, it is seen that the patients who are nulliparous means who have not born any child, in them there is a risk of having uterine cancer. But no, it is not the only cause. It's not like those who don't have children will have uterine cancer. It's not like that, but it is like a risk factor. Secondly, it happens at a later age. It's not a cancer which happens at early age, say in the 30s. It usually happens in 55 to say 70 years of age group. Or you can say that it happens in the perimenopausal and the postmenopausal age group. Also, it is seen that the females who are taking hormone replacement therapy, hormone is actually the estrogen hormone replacement, we call it in short form HRT. If they are in HRT for say more than 10 years, so the dose and the duration again is a risk factor. So for long duration, high dosage, it then predisposes the patient to uterine cancer. And the patients who are having anovulatory cycles, like that which is happening in PCOD, okay, ovulation is not happening. So then again, also genetic factors, so something which is at gene level, which is really not in our hand, because of that, it again predisposes the patient to have cancer. Then here also, dietary habit also have some effect. Those who are taking lot of animal meat, and who are taking say animal fat, then in them the risk of uterine cancer increases. Also, there are some kind of diseases in the family which then predispose, like anorectal cancer, the cancer of the intestine and the anus, okay, and the rectum in any family member, or breast cancer in the family member. Then there is something called as Lynch Two Syndrome. If this kind of history is present in family, then patient becomes, or the person becomes susceptible or more prone to have uterine cancer. Then there are certain drug exposure like tamoxifen, which is usually given for the patients who are having breast cancer. If it is taken for a long duration, unsupervised, then again it can cause uterine cancer. Also, apart from all this, again I'm saying that the females who are obese, who are having uncontrolled diabetes, hypertension, they should be very much aware of it, that they have high risk of having cancers. So your BMI should always be normal, and you should now pay attention on yourself. This is the time. If you are obese, you should pay attention on yourself, on your health. This is the right time, because obesity, I'm always saying, it not only causes cancer, it causes lot of problems to your body, even to your mental health. So you should
Absolutely.
always keep track on your health. Okay, apart from that, you should always try to groom yourself. Pay attention, give time to yourself. Yes, family को हमें टाइम देना है, बच्चों को टाइम देना है, बट हमें रोज अपने ऊपर भी टाइम देना है. कितने दिन हम तैयार होते हैं लॉकडाउन में, when a person just groom himself, it creates, or the mind secretes, brain secretes some chemicals in the body which brings happiness, which feels by which you feel very good. So that's why I will again and again say, give time to yourself, your body, your mind. Think about yourself. Don't be selfish, but yes, we should put some time on us as well, because females, they are so busy personalities. I mean, हम अपने आसपास ही देख लें, कितना काम करती हैं, घर पे भी काम कर रही हैं, ऑफिस का भी काम कर रही हैं, एक्स्ट्रा काम भी करती हैं, बच्चों को भी संभालती हैं, ठीक है, और अपने बारे में सबसे कम सोचती हैं.
Absolutely. I think you said it very correctly, and very beautifully you have mentioned. That is the major part women always forget about. They always think about others. They are always busy in other things. They do not, focus on themselves, which is actually important, doctor. So I think that's all for today. I think there is too much to learn from you. I think we actually need a separate session to talk about the other several part of cancers. Maybe we can talk more in detail about other things as well, because I have a lot more questions for you, but probably we can have a separate session on that. I think it is required that. And for today, I think it is very important for those people who are, getting into a different kind of lifestyle now. They can actually make their life better with these answers, and they can actually work on themselves, while knowing this kind of information and knowledge. So thank you so much for being with us, doctor. And I would separately have another session with you on the other kind of cancers, and we'll talk more in detail. Thank you so much for your time. It was great having you here.
Thank you.
Thank you so much.